there's always a balance to things. First, from an efficacy standpoint, while the medians are very, very impressive, in all of these trials, there is a range. And there are some patients that will unfortunately have progression of their cancer really within the first year or two. And so we don't get that long-term benefit for everyone, and still trying to figure out who those patients are. But the other side of it is toxicity. And so when we think of side effects of these ALK-directed therapies like lorlatinib, Mary, some of the side effects are things like cholesterol. We can see an elevation in the lipid profile. How do you discuss that with patients? How do you monitor for something like that?
So we have the discussion. I'll have the discussion with the patient I see them after they've seen the oncologist, and initially I get a sense from them what they understand of what they've been told, and ask them to explain back to me in their language just so as we both have an understanding of where we're at. And I think it's really important that I get an understanding of what they've what information they've heard and taken out to me, and then we talk about blood tests. And if they mention blood tests, I ask them, was there anything specific? And then we talk about cholesterol. And then depending on the age of the patient or whatever, we talk about, have they had it done before? Is this a new drug test for them? What does it mean? And make the linkage between the importance of having a specific test like cholesterol, which is really important in the ongoing management of their lung cancer care for the duration. And then check with them, with somebody like, we say Ben Solomon has said how often he's going to check the cholesterol. And one part of my role then is to make sure that they understand the importance of having that drug test, that it's not an option out or an option in, that they must have it, and make sure that they understand why. And often, that might be the focus of our consultation purely, is maybe at this point in time, having the conversation about cholesterol, something they had probably not thought of before when they're coming in for cancer, why it's important, and explaining in the language that they use. I try and modify my language to their language rather than the other way around, so that we have an understanding. And checking in with them, I can get things, misunderstand what they're saying to me. I check with them that they understand what I'm saying.
Mary, you mentioned that the first thing you do is say, what do you understand? How often, are you surprised by how often there's a little discordance there between the doctor says, I've explained everything already, and how much is being heard? Do you find that there's a big difference?
Yeah, I do. And it's interesting, it's always interesting, if there's the person, the patient, and if there's somebody with them, I also check with what they've both heard. And allow them to say, it's the reason it's really important you have somebody with you, because we encourage you to have somebody with you, because you'll both hear different and important information. And then if there's pieces that I know the oncologist has discussed with them, I'll prompt them to see if was there anything mentioned of this, and just to see. And if not, we'll take it back and see how much information they want. So to answer your question, I got offline there, I'm sorry about that. Mm-hmm. But to answer your question, I think as human beings, it'll be very, very difficult for them to remember everything that they've gone through. And I think it's always, I offer them, it's an individual thing, would they like some written information about the key dot points of what was discussed? Would they like a copy of the discussion? And say to them, it's not mandatory, it's not obligatory. It's up to you what you like, what way you receive your information. There's this is about you, what way you take information about any aspect of your life. This is about your health, and this is about your newly diagnosed cancer and your future going forward.
Laura, do you find similar things, that there's a little bit of a disconnect, that maybe when we go in there with a 10-minute monologue, I know Shirish can be a little wordy at times, that maybe some of those things are a little overwhelming or lost?
Absolutely, yeah, and I think that's great, Mary, what you said about making sure you're meeting the patient where they are, but also to have that conversation repeatedly. So not just say I talked to them about it once and they understood. Bring it up again each time, and really make sure that they understand. They haven't thought of new questions that they didn't have initially, and make sure that consistently throughout their treatment you're checking in with them to make sure.